in the city. Cities all over the United States are being affected by COVID-19 at a much more devastating scale than the more rural suburban populations of the United States. What do you think, when this is over, this is going to mean to our cities who have been affected with so much illness and sadly death because of COVID-19? How do you think it's going to change our cities?
Yeah. Well, I think one thing that's important for us to understand is how COVID has hit people in the cities. While it's hit everyone in the cities, it has not hit everybody equally. And I think that's also going to help to lend and frame up about what we think about the future of our cities, because we've seen disparities in health that have been allowed to exist far too long and have not just revealed themselves, but also been exacerbated. Black and brown communities are dying at twice the rate for COVID-19, and that's really because we have allowed it. And I think about it where, even in my own case, and why this is a very personal thing for me, my father, when I was 3 years old, from a treatable virus, because the hospital sent him home and asked my mother if he was prone to exaggerations. His clothes were a little bit too haggard. His mustache was a little bit too unkempt. There was an assumption that he didn't have insurance. And so what's happening right now, and when you're looking at the disparities in the way that COVID-19 is impacting communities, both on a health side and also on an economic side, it's staggering. Consider the fact that over 40% of people in this country couldn't afford a $400 shock, and that was prior to COVID-19. 22% of people who have lost their jobs since COVID-19 were people who were living in poverty before, i.e. these were people who were working and still living in poverty, the working poor. And so when I think about the way we have to rethink our cities and rethink the way that we live, we have to make sure that people have a firm enough support system that when these singular individual shocks happen, many of which that they are not responsible for at all, that there actually is a way to be able to support them, that we can make sure that we are not having people who are working a full day's work and still living below the poverty line, that we can make sure that we have a healthcare system that does not leave people uncovered, and particularly one that relies solely on employment, because when you have jumps in unemployment, what has also now happened, you have jumps in people who are uninsured. And so this actually creates an opportunity for us to rethink the way we are going to structure our societies, our cities, start thinking about transportation assets to be able to move people around in a safe way. But this moment is one that we have to capture now and rethink about how are we going to view the next 3 and the 5 and the next 10 years for our existence.
Well, Wes, thanks so much for being here. It was great to see you again.
It's so good to see you, Stephen. Thank you so much. Stay safe.